Today, in private practice in Brazil, the cesarean section rate is 95%. Women don't want to have normal deliveries. They don't want to have labor pains. They don't want to go through all the process. It has become a style, fashion to want whatever they want. And demand cesarean section has become a norm in many of the European and the Latin American countries. It has its own drawbacks. And I mean, there's no question about saying that normal delivery would be any day better than a cesarean section. But the cesarean section, you cannot pinpoint a figure to say that maybe 20% is the right figure or 25% is the right figure, because situations differ from area to area, situations differ from patient to patient, and it is individual patient that decision has to be taken whether the patient requires a cesarean section or can have a normal delivery. Now today, when you are having one or two pregnancies and not more, if you look at average population, nobody wants to have more than 2 children. And every child that they deliver, they want to make sure that it is healthy, perfectly fine, normal, without any complication, without any trouble. And when that is happening, there is tremendous pressure on the obstetrician as well, because when you look at the maternal mortality or morbidity, even the figure that I was looking at, Telangana's maternal mortality today is 92 per 100,000 live births. The national figure is 167. So Telangana, if you look at it, is nearly closer to half what the national figures are. If you go to UP and Bihar, it's huge because it is compensating for what is numbers which are lower down in the south of India, Kerala, and everywhere else. So when that is happening, when you look at however perfect you may be and however best your system is and however best your facilities are, still in this state, 92 out of 100,000 are dying. If you look at even America or Europe or anywhere in United Kingdom, the maternal mortality is 15, but still that means 15 out of 100,000 are dying. Between 12 and 15 is the maternal mortality there. So which means that there is no such thing as 0%. No pregnant woman who goes into pregnancy can say that she will be 100% normal and give a 100% normal baby, because there are perinatal losses as well. Babies also die during delivery. Babies die as stillbirths, during antenatal period, during the immediate following delivery. So the losses are bound to be there. But today's generation, people feel that when you go to a hospital for anything, you must come out well. There is no way anything can go wrong, and no way anything should go wrong. Even if you get a heart attack, there should be a bypass and you should be normal and come out. And you cannot die once you're. If you die, it is the doctor who has made the mistake and you're dead. If nobody is going to die, 1.2 billion population of India is already there. You can imagine what's going to happen if nobody is supposed to die. So somebody who is born has to die some stage, whether it is today, tomorrow, whatever destiny is, sometime person has to die. But unfortunately, when you look at it saying that normal delivery has a risk of maybe XYZ in your setup for the baby, the most difficult part of any individual in life is the travel of 10 centimeters during labor from the mother's pelvis to come out from inside out is the most difficult journeys that a human being undertakes in their life. From here, Hyderabad to the airport is not the most difficult journey. It's the time of delivery which is the most difficult journey. And when that difficult journey is being taken, problems are bound to happen to the mother and the baby. And if you are expecting not to undergo that, then you will say that I want a cesarean section. So this is what is happening today, that younger generation, women don't want to have normal deliveries, they want to have cesarean section, they don't want pain, there is no such thing, labor analgesia, even if it is given, they don't want that. So all these things contribute. It's not something which is contributing. And when you're looking at children where 2 children norm, you want 100% normal, you don't want anybody to be slow, difficulty having in labor, then you say that, well, okay, cesarean section would be the better way of doing it. So all these factors and poor understanding of the obstetric scenario by women at large, a situation where the cesarean section is rising. It's not only rising in this country. If you think that today cesarean section, the average cesarean section in this country is somewhere between 20 to 25%. 25% cesarean section rate exists in this country. In America, it is closer to 30 as well. In any other countries, if you go, as I mentioned, up to Brazil, which is private practice, is 95%. So in a scenario where you have a cesarean section rate which is lower in rural areas because there is availability is not there, and if that section rate is maybe 10%, and the private scenario in the city of maybe Hyderabad, the section rate is 40%, the average will be 25%. So what is really happening is that the affluent class of patients do not wish to have normal deliveries, and that is a reality which is happening all over the world. Anywhere smallest evidence of complication, cesarean section is the alternative to taking the risk of normal delivery. So all that is pushing the section rate. It's not any individual, nobody wants to really to do cesarean sections for the sake of doing them, which is not at all required in an obstetric situation. No, there are situations where women come to you and say that I don't want normal delivery. No, as I am saying, in Brazil it's 95%. The demand, India also in the cities you will find that at least 15 to 20% of the women who come and say that I don't want to have normal delivery. So that is happening. It's slowly it is happening. So when that scenario is happening, bound to the section rate, overall section rate is going to go up. And what is happening is that the first time cesarean section, the second time also lands up with a cesarean section. So the patients, if 95% deliver by first time cesarean section, 100% of them will deliver by cesarean section second time. So overall section rate will keep on mounting because of this duplication that happens, because previously we were saying once a cesarean section, not always a cesarean section. You can have normal delivery. But nobody wants to take a chance because the risk of rupture uterus, risk of complication to the mother and the baby is always there. Whatever point, 10% risk is there in happening that. So even if that is there, nobody wants to take that risk, which means that you will end up with a cesarean. So primary cesarean section rate going up is resulting in the secondary cesarean section rate nearing 100%, and therefore the overall section rate, when you talk in terms of total section rate, is mounting.